Well, my predominant role is director of the MS clinic, which means I have some role in how we run the clinic, and then I see patients there. And then the other major thing I do at the Health Sciences Center is run our clinical research program. Well, my particular area is referred to as epidemiology, so that's when you look at who gets particular illnesses, why they get it, what happens to people once they have it, and so I focus on multiple sclerosis. We also do some work in clinical trials trying to look at new treatments for people with multiple sclerosis. So the paper focused on survival in people with multiple sclerosis, trying to understand whether this was still different than people without MS who live in Manitoba, and what factors might be related to survival. Importantly, we found that people with multiple sclerosis are living longer than they used to. So most people with MS can expect to live quite long lives, so into their 70s. We also found, though, that there's still a gap in life expectancy between people with MS and people without MS, on average about 7 years. Well, I think it tells us that people with MS are getting some of the improvements in life expectancy that we're seeing in the general population, which is a very good thing. But it also means there's a gap that we need to work on. In this paper, we also tried to understand whether other health conditions impact that survival in people with MS, because just because you have MS, it doesn't mean you don't get things like diabetes or high blood pressure. And so we found that those things do impact survival, but it wasn't worse than if you were someone in the general population. So that was also a good thing. It means that we can potentially do better if we work on the things like the diabetes and high blood pressure, but people with MS who have those aren't worse off than someone in the general population who has them, who doesn't have MS. So it's kind of a mixed, some good things and some bad things. I think it also points, though, to the importance of remembering when people live longer, we also want to make sure that they have a good quality of life during that time. And so that's an area we didn't address, but is a really important one when we're thinking about prolonging life. We want it to be a good life. Well, I think one important question that this study did not address, but I think is of great interest and importance to individuals with MS as well as those who are treating individuals with MS, is what's the impact of the newer disease-modifying therapies that we have available. There's been some suggestion and some studies from the United States following people who were in the first clinical trials of those therapies that they may improve long-term survival. We didn't address that, but I think that's another important question that needs to be looked at. Well, I think it's part of us understanding factors that may impact outcomes that are important to people with MS. So I've had a particular interest in other health conditions because there are many more treatments for those. So I think it's really valuable to look at things that we might be able to change. So right now it's hard to change somebody's genes. Can't really change you from a female to a male in terms of your biology, but I might be able to help you prevent your health conditions. We might be able to help you better treat your diabetes with changes in diet and medication and exercise. And so I think understanding more about how those factors affect MS is really valuable. And so our long-term goal is to understand how we can do a better job with all aspects of the person with MS's health, so that we can help people have a better quality of life over the long term.